That was the one thing Miss Shamblin was in here last week, and she was saying how much she enjoyed teaching and how it just makes her heart really happy when she's in a hospital and she sees one of her students doing what she helped create. And it kind of really made me excited. It's really neat.
It is, and it's such a great thing to see the growth from whenever you start in fundamentals and when we see you in leadership, and then when we see you in the hospital. I taught Miss Stacy Mayu that will be teaching you if you've not met her yet. Okay, Betty Newman uses a systems model. Oh, first of all, you have the diagram here, and what I'm going to be saying and telling you today is all on here. You'll just have to look at the pieces, and I may talk too fast. If you do not understand, I need you to say to me, slow down, or I have a question. She provides a worldview of nursing that embraces a systems approach. She maintains a focus on the client for a plan of care which is holistic, and that's one of the things you'll hear, is that Betty Newman is holistic. And what does holistic mean to you?
Teaching mind, treating mind, body, and soul.
That's right. We're looking at the whole picture. You're not just looking at the physical. One of the things I see, and sometimes you'll see this spelled with a W, W-H-O-L-I-S-T-I-C. Especially when students first start out, they want to just look at the physical part of an individual. But do you have other parts that we need to look at? Even as a student, when we're teaching you, do you have other parts that we need to look at? Sure, and so do our patients. And then she establishes nursing as a unique practice that addresses the client's system. So that means it addresses all of that person. The client is divided into individuals, family, or community in relationship with the environment. And the reason this part is on here, I want you to understand that when you first start out in nursing, you're going to be working with one patient, and that is your client. As you grow, you're going to be going to groups, but the group is your client. Follow me? Then later on in your senior level, you're going to be working with a community. That community is a client. It is several people in groups and community and in families, but they're all considered a client. So she looks at the basic beliefs and the assumptions of the systems. She looks at a person. She looks at health, and that's on a continuum. She looks at the environment, and then she enters into that nursing and nursing interventions. So let's look at the client. The client, whether it's a person, whether it's a family, a group, or community, it comes to you unique. Are you unique, each one of you? Sure. You have some common elements, but you're unique. There are some innate characteristics that you're going to find in this client. They have a normal range of responses. Do you have a normal range of response in relationship to stressors? Do you relate to stressors the same way that your husband, if you have a husband, or your children relate? We all have a normal range of response. It's normal for us. And that is going to be, and if you look at your diagram, that is the normal line of defense. If stressors breaks through the normal line of defense, an interrelationship of variables determine the response that that client is going to give. And it's really important to remember that, because first of all, when it breaks through, it can make the patient ill. But the other thing I want you to remember, we all respond to stressors in a different way. And I always use a pain threshold as one of those things. Your pain threshold may be very high, so you respond to pain in a different way. But your patient may have a pain threshold that is very low, and so they're going to respond in a different way. So just remember, it's how they interrelate with the other variables. We're always looking, and Betty Newman is looking for the optimal state of wellness. So whether you're in wellness or illness, she's still looking for the optimal state. Give me an example of an illness, but you could still reach your optimal state.
How about diabetes?
Diabetes, very good. Diabetes is one that we would probably call an illness to some extent because they're having to watch and to do different things, but they can be at their optimal state. If they were at their optimal state, how would they function?
Like you or I mean, if they're optimal
Yeah.
state.
It would be normal for them. Their normal may be that they'd have to watch what they eat, watch their sugar intake, take their medication, but it's still the optimal state for them. And I always think of someone who's had a CVA, a stroke. They have an optimal state, although they may never get over that stroke. They may always have maybe a paralysis of the arm or the leg, but they are able to compensate. Each of us has a line of resistance. You'll also see that on your little diagram, is that you're going to see a line of resistance. A line of resistance is a resource, and it functions to stabilize us to a wellness state. Now, there again, this wellness state is an optimal state. It is the very best that you can do. And so you have that line of resistance that's going to give you some resources. Each is a dynamic, constant energy exchange with the environment. If you look on your diagram, the very center is where it has your basic structure, and that's your energy and your resources. And that's the area you don't want to break through, but it is your energy exchange occurs in that very center. And then you see the lines around it. Betty Newman talks about primary, secondary, and tertiary. Whenever she looks at something, and when you look at something when you're doing your nursing care plans, you're going to be looking at primary, secondary, and tertiary prevention. I'll tell you now that a primary prevention, it would be like attending an education class about smoking. A secondary is when you break down and you become ill. You receive treatment. So you can think of it as a hospitalization. Tertiary prevention is what occurs after you've been discharged from the hospital. Okay, and we'll go over that again. It'll pop back up. Health is reflected in the level of wellness. And as I said, she has a continuum. Optimal state is what she's always looking for. You can think of it in another way, in that it's the state of stability. She's looking for the state of stability. When the system's needs are met, optimal wellness is going to exist. Remember, it may not be complete wellness, but it's optimal wellness is going to be met. When system needs are unmet, it reduces that wellness state, and you're probably going to see someone who is becoming ill. And there's some on the continuum, they're going toward the illness area. Questions? Since I'm hoping to hold two things, let's see what else I can find on my notes that I need to say to you. And then we have our environment. You know, we said at the very beginning that she looks at the relationship between the client and the environment. And so this is what she means by environment. It is the input, the output, and the feedback between the client and the environment. And it's circular. And I have what is meant by this. So what is meant by this? it is never stagnant. Whenever we have a relationship with our environment, it's never stagnant. It never stays at one point. Our environment gives us input. We give it output. We reciprocate in some way. And then there's feedback between that. I know there's a course you've had maybe in communication where they talked about input, output, feedback. But your environment gives you feedback. Is the environment just the air around us? It's the people that we find in the environment. It might be the medication that we find in our environment. It can be anything, but we have input, we give off, they give off, and it's a feedback, and it's very circular. We're not stagnant. So what she looks at is what she calls major concepts. The client, we talked about the client, talked about the variables, mentioned the environment. We haven't said anything about stressors. We've looked at wellness, and we haven't really looked at nursing intervention, but we'll get to that. Let's stop right now. What can be your client? Just gave it to you. So what is a client?
Our patients.
It's your patient. And can it only be one person? No. So it can be your family, it can be a group, it can be a community. They're all your client. It's according to how you're looking at things. Talked about variables, environment, stressors. What are stressors?
Your family.
Co-workers.
Your health. If you're ill.
Okay. If you had to just define stressors and not give an example, because that's what family and co-workers and finances are, those are examples of stressors. If you had to just define stressors, how would you define it?
Things that cause a response.
Say it loud.
Things that cause a response.
Okay, it's things that cause a response within us. Are they always bad? No, it can be a negative or a positive stressor, can it? But what our body is going to do is to respond to it, isn't it? So it can be negative, it can be positive. It can be something that is just so good, like you won $1 million. It still causes stressors within your body. And then wellness, what did I say? What did she say about wellness again? It's on a continuum, and she looks at the optimal state of wellness, which may not be the wellness that we expect. If I ask you to define wellness, how would you define it? We gave an example, talked about the optimal state. A person who has diabetes, you probably would not say they're in the wellness to you. But to that person, they're able to function, they're watching their diet, they're taking their medication, and so they would be considered a wellness. And if you were doing a nursing care plan, if they were able to have a blood sugar, if their A1C was around 5.8, you'd probably not do a nursing intervention on that person because that's a good A1C. So that probably wouldn't enter into the picture. And then you would do your nursing interventions.
Dr. Larry,
Yes,
could I interrupt you and inject something?
sure.
Something about wellness that I think is really important when we're looking at these concepts, y'all, is that you have to look at the cultural implications of that and the societal norms. So keep in mind that you have to, if you're doing nursing here, it's going to be different than in Texas, than in Arizona, than in the Northeast and the Northwest. Wellness may not be the same thing to us as it is with people in Mexico or Canada.
And that's, very good. And, it's also in the state of mind of that person. And that's what he's saying, and also something that you may think is just, horrible. And that person is so sick, and that person may not look upon it as a real dysfunctional type thing. And so when they start talking to you about nursing care plans, that's one of the things they'll talk to you about. And we'll touch on that just a little bit today about whenever you do an assessment on a patient, because you're not quite there yet. But we'll talk about that. variables. I haven't said anything about variables yet. That's one of the big things with Betty Newman. One of the things she says we have under variables, and there are 5 of them. They are physiological. What is physiological? Let's see if it's, we're going to leave it on that. A variable can be, number 1, physiological. And if it's a physiological variable, what kind of variable is it?
Could it be blood pressure?
Something to do with your physical component of your body, right? And it could be blood pressure. It could be weight. It could be anything that is a physical. The second one under variable is going to be psychological. What is an example of a psychological variable?
When you're given consent for procedure, you want to make sure that the client or the patient is in a good state of mind, aware of what's going on.
Okay, that's one example. What is something else? If we had to give a that's fine, that's good. What if we had to give a definition of psychological variables? What do you think it would be talking about?
Mental illnesses,
Sir?
like mental illnesses,
It could be a mental illness.
dementia, like dementia.
Could be dementia. And psychological can be other things. Have you ever gotten a little down in the dumps?
Sure.
Could that be? Is that physiological?
It can be.
The responses can be physiological. But getting down in the dumps is actually a psychological variable because it has nothing to do with the physical part. The response can be physical, but there can be a psychological variable. The third variable is spiritual. What would spiritual encompass?
Person's beliefs.
His beliefs, okay.
Code of ethics for themselves.
Okay. Probably in your environment, we think of spiritual as being our God, reading the Bible, attending church. Other people may say a higher being. There are other beliefs, but it could be their spiritual. That is another part of the body that she wants you to look at whenever you're assessing someone. The fourth one is going to be developmental. What is developmental?
Age or the mindset of development that or stage that a person is at.
Very good. And then the last one is sociocultural. What do you think that would encompass? Number 5.
Socioeconomic status, your background, your ethnicity, things of that nature, because that could influence the care you get.
Very good. And Mr. Hubbard just said, the care or how people perceive things in this part of the country versus Texas, New Mexico. And so, but it doesn't matter where you are. Betty Newman says this is something that you should check on, that you should do an assessment with your patient. Find out where they are, how do they relate to people. And of course, this is also talking about the relationships that you may have with someone. She says it's very important to find out if that person relates to someone, if they have friends, if they can go out, meet people. And of course, you also have to look at their background. That is her 5 variables that she wants you to assess. Let's turn it and go back just a little bit. We've already played around with this before when we looked at the client. That's just another way that she expresses it. Always keep in mind that it's the interaction that the client has with their environment. If you're looking at the handout that was given to you, she sees it as being very important, and this is what she has derived from that. She has a basic structure, and that's that little round part right in the very center. And that is like a sacred part that you would not want anything to interfere with that basic structure. Because if something happens and it intervenes in that, if it attacks that part, then that person can become ill. That is where you're going to see your energy. And it's the energy of keeping you well, of you not getting sick. And then the lines of resistance, the normal lines of defense, and the flexible lines of defense. Talked about variables. The nursing interventions. Intervention modes are used within the structure of each of the preventions. You have your primary, your secondary, and your tertiary. These are modes to retain, attain, or maintain stability and integrity of the client. Just like Betty Newman believes in the optimal wellness of the client, she's looking for the stability of the client, which are almost used interchangeably. She wants stability of that client. She wants integrity of that client. How would you define integrity?
Do the right thing when it's hard to do so.
Okay. And when she talks about nursing interventions, she is going to use the term preventions, and she's going to use the terms of primary, secondary, and tertiary. When you do your nursing care plans, which you'll be taught later on, you're going to be using primary, secondary, and tertiary. Now, I've already said what those are. Someone give me an example of primary nursing intervention or primary prevention.
Discussing with the client how to lower their cholesterol.
Okay, it's actions that you will take. That's a good example. It's actions that you will take before the person becomes ill and is hospitalized. All of your education programs. What are some education programs in this community that you may be able to tell your client to participate in? What is the big thing in Louisiana right now, education-wise, for everyone? Obesity. What does obesity lead to? What can it lead to?
Heart disease.
Diabetes, heart disease. What? Of course it can lead to joint issues because it's a person who's being very heavy. So a primary intervention that you would use is to get the person educated before they become ill. So that's your primary. What would be a secondary? A secondary prevention.
Place the patient on cholesterol medication because they didn't follow their education.
Okay, it would be the treatment. It would be the treatment of that is a secondary. Usually think of it as hospitalization or something very near to hospitalization, but the treatment of that would also be it. What about tertiary? What is the difference in tertiary and primary?
They're under control with their cholesterol now because they've been taking their medicines and they're eating a low-fat diet.
And so that tertiary might be exercise. It might, but you're right, yes. We're going to throw in another word in a few minutes. It's going to go a little further than that, but you're correct. There's that other word, reconstitution. What do you think reconstitution takes place? What does that do? If that person has had a CVA, if they've had a stroke, and they have been hospitalized for that, but they have been left maybe with paralysis on the left side. How do you think, I'm trying to get you to say it. I'll just say, it represents, reconstitution represents the return and maintenance of system stability following any kind of treatment of a stressor that has occurred with that person. It may result in a higher level of wellness, or it may result in a lower level of wellness. So now tell me in your words, how would you remember that? Does it mean when my patient has gone into the hospital for a secondary prevention and they come out and they start attending, let's say they were a diabetic and they were really having a high A1C and other problems, but they were okay, they came out and they started an exercise program. And the reconstitution, does it mean they're going to possibly go back to how they were before they entered the hospital? They can, or they may not, because it said it is to reach a higher level of wellness than what they went in, or it might be a lower level of wellness. So it can be either way. You might want to think of it, it would help if you thought of it in terms of someone who's had a CVA, they've had a stroke, they have some paralysis, and their reconstitution may be they can now get up out of the chair, although they have a left-sided paralysis. So that means a lower level of wellness, but they are able to function, and that's what reconstitution is. You do not have the Newman's book, but this is just an example. Talked about primary prevention. We're coming back to primary prevention, and it's to identify and allay the possible risk factors associated with environmental stressors. And environmental stressors could be what? Could be their smoking. It could be obesity due to overeating. And the example that's been given here is exercise. It could be an education program about smoking. But understand, primary prevention is when you're talking to a person who's giving you a risk factor and that you want to prevent that person from becoming ill. Look on your diagram. Do you see the normal line of defense? And that's our adaptation line. That is how we adapt to what's going on around us, is our normal line of defense. And so when that normal line of defense has been penetrated, we had a stressor, we couldn't adapt, that normal line of defense was penetrated, and it caused us to be hospitalized. And the system in this case is your client. And that client will have subsystems, which would be the developmental, the physiological, the psychological, all of those. But your system is your client. Then we've given enough examples with this, but just remember, tertiary prevention is when that line of defense has been penetrated by a stressor. And they have been repatterned, or they've been restored back to their optimal state of wellness. Do you need me to go back?
Please.
Okay. Oops. Oh, one more. There you go. Reconstitution represents the return and maintenance of that patient's stability following his treatment of stressor reaction. It may result in a higher or lower level of wellness. In other words, that person may never reach the level of wellness that that person was functioning at before he became ill, but he is able to function. Well, maybe you thought you knew everything about environment, but here you come. We have an internal environment and we have an external environment. And we have a created environment. Sometimes we think that only schizophrenics are those people who have a created environment, but that truly isn't right. We all can have a created environment. Makes us more comfortable. The internal environment are all forces of interaction contained solely within that client, and so it's intrapersonal. Intrapersonal is when it's always within you and it's not outside. It has nothing to do with your family who may be getting on your nerves. It's the response that you may have to your family, but it's intrapersonal. Then it can be external, and that's all forces or interactions outside the boundaries of the client. It can be interpersonal, which we all understand is between two or more people. So it can be a stressor that occurs because of the relationship that you have, maybe with a friend, your family. And then the created one is an unconsciously developed by the client as a symbolic expression of system wholeness. And in essence, that's saying that we create things so that we can function more comfortably at a higher level of wellness or at the highest level of wellness. So we have three: intrapersonal, and you understand that's all within yourself. You have interpersonal, which is between you and someone else. Then you have extrapersonal, and so what could extrapersonal mean if it isn't within you and if it isn't between you and a person? Okay. A force occurring within the client is your intrapersonal. And Mr. Hubbard was correct. We usually look at that as environmental, what's in the environment. The stressor's effect on a client, and you may say, well, you know, that stressor didn't bother me. Well, maybe it did not bother you, but it may bother the next person, because remember, initially we said that people are all unique. They have innate characteristics, and what may bother you or what would not bother you may bother someone else. And so the stressor's effect on the client, usually there's two factors that we look at. Number one is the strength of the stressor. Do you believe that some stressors have more strength than others? What would you call a stressor that is really strong?
Maybe, this is really bad, but the death of a spouse.
I was thinking that too, or the death of a child, versus what would be a stressor that would not be quite as strong to the majority of us. Can you think of one? School, making an F on a test, you know, that's not the end of the world. You have other tests usually that you can take. There are other ways you can cope. And so, of course, coping becomes a factor in this also. And then the number of stressors at any one time. What do I mean by the number of stressors at any one time?
Well, multiple stressors. You know, I mean, and again, here I'm being like totally morbid, but you know, maybe your husband died and your child died due to a car accident. You know, you've got multiple, I mean, that would be big.
Okay, and that would have, you know, a different effect on the client. And so when you're doing an assessment on the client, you need to take those things into consideration. Someone was telling me yesterday about a man whose wife died, and 4 months after that, his only son and his wife and only grandchild died in a car accident. That is an example of a multiple number of stresses occurring at that time. You know, you'd make note of that. There'd be different counseling sessions you would need them to go to. There's several things that would take place versus if the student failed a test, yes, you need to make note of that because it's going to have a response to their body, but it's not as severe. And I think we can say in everyone's eyes, because we have to be careful about severity. What we consider a mild stressor may not be a mild stressor to that individual. Do you follow me? So we can't just dismiss any stressor saying, oh, well, that's, you know, a kid fell in a class. I mean, what are they talking about? That's not bad. You know, at my age, there are other things that you would prioritize. So we have to be careful about that. But you do have to consider the strength of the stressor and the number of stressors at any one time, and make sure that you make note of that. If you look on your sheet, you're going to see the flexible lines of defense. It protects the normal line of defense or the state of wellness that this person is in. It's the immediate state that we're looking at. It's that outer line. The flexible line of defense can be influenced by your sleep, by maybe your hormone level, how many tests you have that day. It is the boundary between the client and the environment. The next one you have is a normal line of defense, and I've said that over and over again, that's adaptation to stressors over time, and that is just considered normal for you. Can you think of an adaptation to a stressor that you have and you've adapted to it over time? Can you think of a stressor maybe that you don't have but your mother may have, or a friend?
Diabetes could be one,
Diabetes could be one.
something health related. And you could take medicine. You could take medicine to control it, or heart disease, some sort of form of heart disease.
We just adapt to that, okay? Can you think of anything else? Work. School. I believe in one of the books that you have, and it might be in your textbook, but it talks about, you know, a mother decided to go back to school, and she's a mother, she goes to school and she works part-time. You know, those can all be stressors. But she may be able to adapt to that. That might be her normal line of defense. Someone else can only go to school. They cannot maintain a work, or maybe there's no children involved. So that's your normal level. And then you'll have your lines of resistance. Do you see your lines of resistance? If your lines of resistance are not successful, it can lead to death, or it can lead to an illness, because it is that line that is very close to the center, which is you, that core. And so your lines of resistance can lead to death if it is not successful. It helps to decrease the reaction that you have to stressors. The lines of resistance helps you decrease the degree of reaction to stressors. It can be looked upon as a resource. So if you have a stressor coming into your life and you want your lines of resistance to come up with a resource, what might be a resource that you would look at?
Your spiritual beliefs.
Spiritual beliefs could be a resource. Mm-hmm.
When we talk about this, I remember my mother had worked for a large energy company back in Oregon for almost 30 years. And her new boss he was a total troll to her. And she ended up with really bad blood pressure issues. Her blood vessels would pop in her eyes. She would get migraines. She ended up having to leave her job. And once she did that, she was so much better.
Okay, and so that situation was invading or penetrating her lines of resistance.
Right.
And it was getting to her core.
Right.
Very good. That's a good example. Okay, I have a habit of coming by and saying it before we get to it, but you've heard me say it, so now you look. You know, it's your immediate state. What else can be? What can cause you a stressor? And it may be just a minor stressor that comes up, you know, maybe during the night or in the morning or whatever. What could be another example? I've given you two: sleep and hormone level. Anything else that you can think of?
Moving to a new state, probably.
I'm sorry.
Moving to a new state.
Moving to a new state, yes.
Kids.
Oh, kids, definitely.
Children, having to get those children up in the mornings, and maybe they're sleepy. And I had a meeting on Tuesdays. I attend Rotary, and so I left from the school here Tuesday a little later than usual, and I go over, and it's at the City Hall in Ellick. So I start over there on Main Street of Pineville, and the bridge is up. And I'm thinking, oh, I'm already late. The bridge is up. That can be just it's a small stressor. 15 minutes, the bridge was lowered, and we went on about our business, but, you know, just for that moment. And I'm sure people today had some flexible lines of defense whenever they were trying to get across the bridge, especially the Purple Heart, and they said they were slipping and sliding in the ice, so. Huh?
grammars.
Sometimes you look at an individual and you wonder how that person can adapt to all the things that's going on in that person's life. But coping skills come into it, and they adapt, and it's considered normal. And in your mother's case, to return to normal, she left that job, left that position, and she returned to a stable health condition. You know, several of you were late coming in, and I just want to say, when we started talking about the Newman's healthcare system model, I said to the students, this is something that you're going to be using. You're getting it now, but you're going to be using it throughout the nursing program. It's a framework for our school here. So it's used, you need to understand it. It may be, you know, like, well, I don't get all this stuff she's throwing out at us today. You need to understand it. It's going to cover a great deal on your final tests in this class, but also you'll be needing this next semester and the next semester, or as long as you're here in the nursing department. You're also going to hear about Betty Newman if you go on to graduate school in some of the universities here. It is a model, a nursing model, and it is the framework that we use here. Okay, any questions thus far? All right, this is that little round spot in the very center in your graphic. All of ours may be a little different. We all have those innate characteristics. We're all unique. But for an example, it can be your normal temperature range, your genetic structure, your response pattern, the strength of your organs, the weakness that you may have, and your ego structure. Can you think of anything else that we may consider innate to us that you would find in the little common circle that we have in the very center?
Your family structure.
Your family structure could be a little different than your genetic structure because you're thinking about oldest, middle, youngest. Okay, very good. What else? Can you think of anything else?
Work. Your occupation.
Occupation, I'm sorry, yes. Okay, that gives you an idea. Just remember that we're all innate, we have innate characteristics, we're unique, although we may have some similarities to other people, but that basic core is what is unique for us. And when that line around there, the resistance is penetrated, then it can cause death in that individual. So you're really looking at the common core can be your blood pressure. It can be the state of your body, any of those things. It can be the psychological. Some people may, if it's penetrated, they may commit suicide. So it's just that basic, what you find in that common core. Any other? Do you have anything you'd like to add before you take a short break? Okay, I don't know how long he gives you for a break, but
5 minutes.
okay. Great.
Right.
No, I don't like that. I want to get in there too. I want to get in there.
Right.
Unless it's done before this.
Wellness is health is reflected by the level of wellness, and this just gives you two terms. One is less energy is produced than required, and that causes an illness. And that makes sense, right? Because we said in the central core, that's where your energy is stored. And so if that area is penetrated, an illness can occur because less energy is produced than is required by the body. And then when more energy is produced than required, you do have a wellness.
So the more energy, better you feel as well.
Yes. Which makes sense, doesn't it?
Yeah, because when you exercise, you feel good.
Mm-hmm. Yes. You know, very simple things like drinking enough water, at least 8 glasses a day, can make you feel better. So out of the central core, where you have your energy, where you have your makeup, this is what it's talking about. And of course, in terms of wellness. The big thing I want you to remember, and I've said it before, the goal for Betty Newman's healthcare systems model is to keep the client stable. The main goal is to keep the patient stable, or the client. And I've already said to you that she uses prevention when she's talking about nursing interventions. And interventions are based on degree of reaction to the stressor. We can all have the same stressor, and our reactions could be much different. It's our resources. Some people have more resources than other people. And we think of resources as something outside in the environment that you can get to, and that is true. It can be a counselor, it can be education, but it can also be the resources within yourself, your coping. The goals, you know, she wants stability of the client, but there are goals that lead up to that, goals that you can develop that will lead up to that. And then the anticipated outcome. Do you expect that client to be restored to his wellness that he was experiencing before the secondary occurred? Whenever you're doing your assessment, you're going to look at actual and potential stressors. What would be a potential stressor? Can we talk about your mother?
Sure.
Okay. Her actual stressor was what?
Her troll of a boss.
Okay. What could have been a potential stressor, which I think it turned out to be a real one, but what could have happened as a result of this?
Well, I mean, a worst case scenario, she could have had a heart attack. She could have had it. She was having those issues with her eyes and the blood vessels popping. I would think maybe an aneurysm or something because there was a lot of the elevated blood pressure.
Okay. So based on your assessment of what is going on with this person, you can also extend that to be what may this lead to because of your correct assessment. Blood pressure is elevated, angina pain, and this is not something we expect you to do this semester, but remember, this is something that you'll be using throughout. So then you have your lines of defense. Remember the lines of defense. Their strength, your resistance, your weaknesses. And we all have a strength. We all have a weakness. And that may be something you ask the patient. That might be something that you can look at your patient and you can decide on your own, and you may validate it by asking that person. What kind of variance from wellness does this person have? Can you give me an example of a variance from wellness? We keep using the term diabetes. Do you think that is a variance from wellness?
You mean like a shift from being healthy to?
Yes, a shift.
Yes.
Okay. Hypertension could be a shift, couldn't it? So if someone says to you, you know, my blood pressure is up, I'm having angina, I'm having pain in my chest, my arm feels numb, you want to make sure that you document that, because they may point to someone having some heart problems, some cardiac problems. Then the nursing goal, you will come up with other goals, but remember, she's always looking for stability. And nursing interventions are what? Primary, secondary, and tertiary, aren't they? So your nursing interventions, it's what you're going to do. To be more specific, is what are you going to do? That person has hypertension, blood pressure 200 over 110. What may you do as a nursing intervention?
I think that's where we need to contact the physician.
Mm-hmm.
And, you know, that person needs to be evaluated for medicines.
Okay. And then let's say the doctor has ordered the medication. What part do you think the nurse would want to play then?
That's where we would probably have to counsel the patient on the necessity of why they need to take that medicine.
Okay, talk to him about the medication, when he should take it, what it's used for, side effects, and that sort of thing. And maybe involve him in an education program so he would have a better understanding of blood pressure. And maybe, what about discussing what may elevate his blood pressure? You know, what kind of stress is he under? And he may not see it as a stressor, but you know, you may say to him, just tell me something about an everyday occurrence with you, or just discuss with me your day's activity and see what comes up. And then whenever, this is like your nursing care plan, and you always evaluate it. So what you're evaluating is going to be your nursing intervention and your goals, and they'll talk to you about that later on, but you always want to evaluate. Why is it important to evaluate, say, your nursing intervention and your goal? To see if they're effective. Of course you would know that, wouldn't you? Sir, you were
I
in
was going to say the same.
Okay, yes. Want to know if they're effective, because if you're not going to evaluate it to see if it's effective, you know, it's just a sheet of paper.
Well, maybe the nursing goal that you provided to that patient isn't doable, so that's another reason why you would need to.
You know, the patient may say, and actually the goal should be between you and the patient. You should discuss it with him, because he may say, you know, I can't attain that. That's just unrealistic for me. So something that we feel is very realistic may not be realistic to that patient. And if he has hypertension, he may say, you may say, exercise. That's going to get your blood pressure down. Walking, whatever it might be. And he may say, you know, I have arthritis. I just can't do that. I need to come up with something else. So, when you talk about Newman's, she's talking about stressors and your reaction to stressors. So the whole thing is about stressors. She believes that everyone has stressors. They can be good or bad. And she says that there's a reaction you have to stress. Let me say again, I know I'm repeating, but let me say, we all react to stressors in a different way. 3 of you in this room may react the same way, but the rest of us may react in a different way. But usually everyone has her own unique way of reacting to stress. We've talked about this, just for you to get it down. It's an open system. That means we do not have a closed system, that there's always stressors, there's always environmental things that's coming in. We always have a repeated cycles of input output, we have feedback. Although client sounds like one person, it can be just the individual, but it can be a group of people, it can be a family, or it can be a community, and they're always considered a client. Our body is going to try to maintain a balance. When the lines, especially the lines of resistance, penetrate it, then we lose that balance. But that is just human nature for us to seek to maintain a balance within and outside our system, and our system is our body. And those things that mess up our system are our stressors. And they can be positive or they can be negative. We usually look at stressors as being negative, don't we? But they can be positive, something good that's happened to us, and it's still a stressor to our body. Questions? Nothing on this page is it's not anything you haven't heard before today. But just to reemphasize, it's hard to see through me, isn't it? Okay. Any questions? Okay, I want you to get out your sheet of paper that looks like this. I just want to go over it to make sure that I haven't left anything off. I want us to look at the circles that you see. Are you with me, or are you still writing? Okay, do you understand about the flexible lines of defense that's out in the far area, and the normal lines of defense, and then you have the lines of resistance, and the degree of reaction is actually left up to that little center core, which has our basic structure and our energy and our resources. We talked about it being a normal temperature range, genetics, response. He talked about can be position. It can be about your insecurities, can be in that little bitty core. Anything that you can think of, intrapersonal or inter or intra or extra, can go into that little core there, that anything that may happen. Remember, when that is, the lines of resistance is penetrated, and that stressor can get to the lines of defense, get to the little common core, then that's when illness can occur. We're looking at stressors. Stressors, more than one stressor could occur, could vary as to the impact or reaction. A normal defense line, which we really didn't mention, it can vary with age and development. The stressor that occurs to a child can be different than if it's a teenager, right? Or if it's an elderly person or an adult or a young adult. So really the stressors, we talked about more than one stressor could occur at a time and according to the strength of that stressor, but it can also be related to the age and development of that individual or that group or that community with that client. Talked about reconstitution. Talked about personal factors being intrapersonal, inter, and extra. Talked about those 5 variables that she works with, and what are they?
Psychological, physiological, spiritual, developmental, and social.
Very good. Okay. Keep those in mind because your instructors, as you go on, they're going to say, I want you to do a nursing care plan. And they may say, use 3 of her variables, you know, either physiological, psychological, or but some of those. Can't just use one. So you'll need to know that. Then we have primary prevention at the very top. You have secondary, early case findings and treatment. Then we have the tertiary. Interventions can occur before or after resistant lines are penetrated in both reaction and reconstitution. We talked about what you need to have with resources, goals, and anticipated outcomes. The reaction to a stressor is also listed on here. It gave you some stressors, but I think we've talked enough about stressors. But here it gives you, and they're just examples, and it gives you the loss of someone, the pain that you may be having, some sensory deprivation, and some changes. He mentioned the fact if you move from one state to another, that can be a stressor. How would you like to move from here to, say, China or Russia? We've seen enough about Russia, huh? That would be a stressor. So, you know, stressors in the eye of the beholder. I think that's all that's on here. Do you have any questions about your sheet?